Street Community Health Center's CEO, Dr. Julie Schuller, and UW Health CEO, Dr. Alan Kaplan. Before we get started, I want to make sure we thank Badger Bay Management for hosting today's virtual event in partnership with Wisconsin Health News. And thank you very much to our generous sponsors of the Wisconsin Health News panel series. One advantage of this virtual format is that we've been able to reach a lot more people than our in-person events. We've reached a lot of new people as well. The feedback we've had so far has been overwhelmingly positive. So I really want to express my gratitude to these sponsors for their continued support throughout all of this. These important and valuable discussions would truly not be possible without it. So a very huge thank you to Ascension Wisconsin, Aurora Healthcare, Group Health Cooperative of South Central Wisconsin, Husch Blackwell, Marshfield Clinic Health System, Rogers Behavioral Health, and WPS Health Solutions. Today's panel is focused on the early lessons that have so far been learned from COVID-19 and what's next as the virus continues to spread across the state, reaching new levels in just the past week. As I mentioned, we have a really incredible panel with us today, so I want to get right into the questions and into the discussion. So I'm going to start with Dr. Raymond. Dr. Raymond, you've been one of the more steady and trusted voices on this from the beginning. You're almost like the Dr. Fauci of Wisconsin. No one has sent us any opposition research on you yet, but I think there are some similarities in terms of the presence and the message that you have provided throughout all this. So I want to talk a little bit about the current state of things. Last week, Wisconsin set records on 3 consecutive days for its number of COVID-19 cases. What's led to this spike, and what does it mean going forward? Is this a blip, or do you expect that things are going to get worse?
Yeah, thanks, Tim. Obviously, that's the most important question. I don't think it's a blip. If you look at the states that are maybe 4 to 5 weeks ahead of us, just in terms of where they were with the pandemic, things aren't really looking good. So I'm talking about California, Texas, Florida, and Arizona in particular. And we are 4 to 5 weeks behind them. So what I mean is we were doing really well. We had 16 consecutive days where our reproductive number was less than 1, and that's a measure of contagiousness. And if it's less than 1, it means that the pandemic is decelerating, so to speak. Now for 26 consecutive days, we've had a reproductive number over 1. And in fact, for 3 days last week, we had the highest reproductive number of any state in the country. So that means that our pandemic is accelerating here. I think there are a lot of factors that have gone into it, and it's going to be difficult to tease them all out. Let me just name a few. We've had multiple holidays. We've had people have lockdown fatigue and start to relax their social distancing and their face masking habits. We've had the protests, and we've had openings of bars. We've had overturnings of various safer at home type orders across the state, both at the state and municipal level. I think when you add all of those things together, you have people that are interacting in more close proximity, indoors, maybe relaxing their guard. And so predictably, we're going to have an increase in the number of cases. What's interesting, though, is over the last month or so, the cases have shifted dramatically from an older population to a much younger demographic. We're seeing a lot of individuals in their teens, 20s, and 30s now that are getting COVID-19, and some of them are actually fairly sick. So that demographic is something that's changed.
And why, talking about that, the change in the demographic, is that due to where we're seeing the causes behind some of the new numbers? Is it because younger people are maybe more likely to go to the bars or some of these places that have caused maybe some of these new numbers, or is it a shifting of the disease?
Yeah, thanks, Tim. I think there are 2 factors. One is we're doing a much better job of being proactive in taking care of nursing home patients. And depending on the state, somewhere between 42 and 43% of the early COVID-19 cases were in nursing home settings. And now that I think we've learned how to control that, your age demographic is going to shift lower anyway. But I think the point that you made about younger people being more interactive, maybe having a feeling of immortality or thinking about risk in a different way than an older population, all are contributing to that younger demographic.
So far, hospitalizations have remained relatively steady in the state, but severe complications and deaths have in other areas lagged behind some of these big increases. Should we expect a surge of hospitalizations in Wisconsin to follow these new numbers?
Yeah, thanks, Tim. So let me just first say that all the early indicators are not good. So that would be the reproductive number, the number of cases that are being reported on a daily basis, and the positivity rate, or the percentage of tests done that result in positives. But our hospitals look good and our death rates are still declining. Again, I want to go back to what I said about the 4 states that we should be looking at. 4 to 5 weeks ago, they had exactly the same picture. Plenty of hospital beds, plenty of ICU beds. Things were looking good and the state was opening up, but they had a troubling increase in the number of cases. And it was easy for them to rationalize by saying, these are younger people. They're not going to be as sick. We're not going to have the same kind of problems that New York and Louisiana had early in the pandemic. And what's happened now is they're filling their hospitals, they're filling their ICUs, and the death rate is going up, not just in those states, but in aggregate across the country. So what I would say is we have a 4 to 5 week window here to do some simple things to control the pandemic so that 4 to 5 weeks from now, we're not having lockdowns again like they're having to do in those 4 states.
What right now are the numbers we should be looking at most closely? Is it the case numbers, the hospitalizations, the reproductive number? Is it a combination of numbers that we should be tracking most closely?
Yeah, Tim, and I certainly want to hear from the other panelists about this, but it's a combination. And I would say if people overly focus on the declining death rates and the copious amount of hospital beds we have right now, we're going to lose an opportunity because in a month or so, these are all going to be full. And so what I would say is look at the reproductive number, look at the percent positive cases, and look at the significant increases in cases that we're having that's far out of proportion to any increase in testing we have right now, and say, what can we do to prevent having these lagging indicators get bad? And I do want to note that we were just an hour ago put on New York's no travel list. So we're on their advisory list now.
So I'm gonna get to the other panelists, but I do have a couple more questions for you, Dr. Raymond, and then we'll come back to you after talking to the other panelists. But what is your understanding of what the status is of the surge facility at the state fairgrounds? Is that still ready to go if needed, and do you think that it will be needed?
Well, first of all, we have 2 surge facilities in the state, and maybe Dr. Kaplan can talk about the one in Madison. Mm-hmm. Yes, it hasn't been used yet, but it's ready to go. And MCW's physicians are actively working with all the health systems in southeastern Wisconsin to be ready to staff that facility up.
COVID-19 has further exposed the significant health disparities that exist in our state. What more can the Medical College of Wisconsin do to respond to this crisis?
Yeah, great question. It's one that we are asking ourselves every day. We've made a generational commitment to have a physical presence in Central City, Milwaukee, in partnership with the Greater Milwaukee Foundation. So that's the first step. But another step, and by the way, UW and the 16th Street Clinic have really worked hard to do the same thing, which is to provide good, well-curated information to people in communities of color, especially early in the pandemic. And that's important. But there's some structural issues that are going to take a long time to address, such as the lack of stable housing, living wage jobs, stable education, safe environments to live in. And those are going to require more than just the health system's intervention to change.
Last question, then we're going to move on to Dr. Schuller. Dr. Raymond, what do you think are some of the most important lessons that you have so far learned at the medical college and how to respond to COVID-19? In other words, what are the most important things that we know now that we did not know in early March?
Wow, well, there's so much to say. I would say that all of us now know much better how to take care of patients who have COVID-19 and to triage them appropriately. We also have better testing and better coordination of our public health agencies across the state, which puts us in a really good spot. The health systems have stepped up and learned how to work together in collaborative ways that are really unprecedented. So those are all the good lessons we've learned. But I would say our role here is to provide well-curated, science-driven facts to the community, because a lot of these issues have become politicized and there's opinion science that's out there that isn't really real science. There's pseudoscience that people believe. And I think our role is just to provide the best information that we can.
Great. Thank you so much, Dr. Raymond. So I'm going to move on to Dr. Schuller. Dr. Schuller, thanks so much for doing this. How would you answer that last question? What are some of the most important lessons at 16th Street that you have learned so far in responding to the pandemic?
Well, hi, Tim. Can you guys hear me?
Yeah.
Okay. Thanks for having me on today. I appreciate being part of the panel, esteemed panel. And I would appreciate you, Tim, and Wisconsin Health News. I think you always have great topics, and this is another one. So thank you. Lessons learned, I think I would touch on three things. The first is health disparities. We all know that health disparities exist, and they've existed for a long time. And many of us, all of us, have been working hard to eliminate disparities. But I think a stress on the system like the COVID pandemic really lays bare health disparities, and did so in this case. At the onset of the pandemic in Milwaukee, we saw a disproportionate number of cases and deaths among the African American population. And as it's progressed, we've seen and continue to see a hot spot within the Latino community on the South Side, which is the community that 16th Street serves. To give some statistics, as of this morning, Milwaukee County had nearly 14,200 cases, 34% among Latinos and 29% among African Americans, totaling 63% from these two minority populations. So the disparity is very clear. And being at the epicenter of the pandemic on the South Side, we've really focused on why. Why is this increased transmission happening in our community? What are the factors that are leading to this increased transmission? And so it leads to sort of a second lesson learned, which is about the social determinants of health. So we've been talking about social determinants for many years now, but the pandemic is really a real-time study in how social factors influence health. Why has there been such a spread within the Latino community? And I don't think we have all the answers yet, but in talking with our patients, our staff, our community, I think we have some. And first is that many of the population in the community work in essential jobs, and many need to maintain their employment in order to support their family. They don't have the financial reserves like others might to weather a period of unemployment, so they remain working throughout the pandemic. Some worked while they were sick because they can't lose their job and lose their family income. And the work that most of our community does is work that you can't do from home. So 80% of the Latino workforce works in 4 industries: manufacturing and production, farming, building and grounds, and food preparation. And these are not jobs that a person can do from home. You have to leave your home to do these jobs. And so it increases their exposure and for themselves and to others, and therefore increases the viral transmission. The need to work, I think, leads to 2 other very important factors. One is transportation. You need to get to work. And so carpooling is a very frequent thing that happens within our community, and increases the transmission rates and exposure to other people. Also, when both parents work, the issue is childcare. So children must be cared for by someone other than their parents. And again, there's an increased exposure to other people and an increased exposure to the virus. And then the last thing I'd like to mention is multi-generational living amongst Latino population. You know, this is a really beautiful feature of the Hispanic culture, which I think brings with it so many strengths. But during the pandemic, where isolation is really necessary, it makes it really difficult to isolate yourself within a family household. So those are 2 really important things. And then I wanted to just touch on one last thing, which is about leadership. And leadership during a crisis is really hard. And during the beginning of the pandemic, things were changing daily and even changing hourly. And so we didn't have all the data and information that we'd like to have. You know, I'm a physician, so I love data and I want, you know, proof, but there just wasn't that information available. And there still isn't in a lot of things we'd like to know about the virus. And the second thing happening and still happening is fear. You know, people are afraid of the virus. They're afraid that it'll affect their own health, someone they love's health, their livelihood is at risk. And so leading in a time of change surrounded by emotion is, I think, has been really hard. For me, what's helped me is to keep focused on a compass of doing the right thing from a moral, ethical perspective, from a service perspective, thinking about what does our community, which includes our staff, our 400 staff members, what does our community need, and what is our and what can 16th Street do to serve the community? And while we don't know all the answers, I think trying to lead through that compass has been a lesson I've learned throughout this.
Thanks, Dr. Schuller. That is great. 16th Street is obviously a leader in this, but what more can community health centers do overall in addressing the health disparities amongst the Black and the Latinx population that have been further exposed by this pandemic in recent months?
Well, a couple of things. I think that for underserved populations, obtaining the needed supplies is very important. So things like masks, things like hand sanitizer that maybe you or I take for granted can be difficult for people to obtain. Mask Up MKE has done a lot of work at getting masks to people in Milwaukee. That's been really helpful, and it's an ongoing effort. I think hand sanitizer is something that needs to be more readily available to people. It's expensive. The stores don't always have it. And so I think that's something that we need to pay attention to. I think when I was talking about social determinants of health, I think it's really critical to pay attention to people having to work. It's just simply not possible for some people to stay home and not work. And we say to them, you need to wear a mask and you need to stay home if you're exposed, but many people just won't, because they're making a decision between feeding their kids or maybe getting exposed. And they just don't have the resources that we take for granted. So I think we need to, as a society, as leaders in the society, to think about what are the solutions that we can give to people. I just think it's not enough to say you need to stay home, because some people just can't. I think also there's an element of shame that plays into it. So they'd like to be able to comply with the rules. They'd like to be able to stay home, but they can't. So maybe, we've heard from some people, they just don't say anything and they go to work. That's probably even worse situation where they're not saying anything. I'm going to be real careful. I'm going to try hard not to get near anyone, but they go outside knowing that they're positive, and there's a shame element that's playing into it. So I think we need to find solutions that make it possible for the people who need to stay home to actually stay home. I think that's a challenge, but I think it's something that's going to be critical as we try to stop the spread of the virus.
So what overall has been the impact of the pandemic on 16th Street, both from an operational standpoint and a fiscal standpoint? I know it's a huge question, but maybe just briefly, what are some of the changes that you've had to make in response to this operationally and from a sustainability point of view? How is this impacting your community health centers?
So from an operational perspective, like many healthcare organizations, we've made a very quick pivot to how we're providing care. We've made the pivot to a telehealth platform for a lot of situations, and then on a secondary line or the equal line, we're doing our testing. So testing outside in a tent is not something any of us, I think, have ever done before, nor have been trained to do. So creating those workflows, making sure it's safe for both staff and patients has been something we've been working hard at, and then changing the capacity of the tent testing as the need for testing and the demand is either going up or down. So that's been an interesting challenge. Telehealth also, while we had a minimal amount of telehealth happening at 16th Street before the pandemic, we switched on a dime to the vast majority of our visits being provided by telehealth. I think that's a good thing. I think that telehealth has been a win-win in many situations. I think it needs to be used in the right situation, so the right care in the right place at the right time. Not all patients can be seen by telehealth in primary care, but I think patients really enjoy it, and the clinicians have very much enjoyed it. In particular, our behavioral health team has very much enjoyed it. The clients are very receptive to visits in the comfort and safety of their own home. And the no-show rates have gone down. Clinicians are able to get in touch with their patients, and so they're able to care for them more efficiently and more frequently. So I think that that's been a good thing. I think as health centers are positioned to ensure that there is access for underserved patient populations, as we pivot to telehealth, we need to make sure that all people have the same access to telehealth. And so we've been thinking a lot about what do our patients need in order to be able to access. You need either a cell phone with a good data plan, or you need an internet connection to a computer. And these are things that our community, some people just don't have. And so we'll continue to work towards what does everybody need in order to be able to access the telehealth kinds of platforms that are developing rapidly as healthcare changes.
What about from a financial standpoint? What has this meant for 16th Street?
So like others, we've seen our visits initially dramatically decline. However, with our switch to telehealth, we're back up to about 75% of where our visits were pre-COVID. So that's not bad. However, our revenues are not what they used to be. I think for us, the PPP loan kind of really saved the day. It was really one of the things that kept me up at night at the beginning of the pandemic was making sure all of our staff members could stay employed. Our staff rely on us. They're part of the community we serve. And it was critical to me as the leader to be able to keep everybody with getting a paycheck. Some people's spouses were getting laid off or furloughed. So it was a very important piece to me of what I wanted to be able to do. And so the PPP loan was critical in allowing us to keep all of our staff employed, keep paychecks coming to everybody that needed them. So we've received a lot of donations as well. We've set up a patient relief fund so people can donate, and the money goes right to people who need it for like rent assistance, food assistance, things like that. So with all of that, I would say we're in a reasonable place right now. Time will tell. I think we're all worried about what's going to be happening in the next 3, 6, 9 months. Will revenues get back to pre-COVID numbers? Will telehealth grow to fill that gap? So those are the things that we're thinking about.
Mm-hmm. Dr. Raymond painted a pretty grim picture of where things are right now and maybe where they could be if Wisconsin does follow this path of some of these other states that have seen increases over the past 4 or 5 weeks. Is there, do you think that it's possible that 16th Street and other centers may have to start canceling some of these visits again of patients that have come back? Or what are your thoughts on that going forward?
So we have created a reentry plan that depends on a number of criteria, very similar to some of the ones that you've seen both at city and state levels. Our reentry plan depends on the positivity rates within our own testing, because we're doing about 200 tests a day now. So we do a significant amount of testing. We have not gotten below 20% positivity rate in our community since the start of the virus. We were up over 50% for a couple of days a few weeks ago. So because our staff is so much from the community and we want to provide a safe environment for everybody, our reopening plan calls for us waiting until our own testing is less than a 20% positivity rate. So for us, we have not fully opened yet. I know the other health centers aren't experiencing as high of a positivity rate as we are. So they have opened and are anticipating possibly having to pull back in the next couple of weeks as well. But for us, we because we're right in the middle of that hotspot, we have not opened more broadly like we will once the positivity rates decrease.
Okay, thank you, Dr. Schuller. So I'm going to move on to Dr. Kaplan now for his take on that last question. Dr. Kaplan, thanks again for filling in. UW Hospital President Rick Ransom was initially slated to be on this panel, but something unavoidable came up, so he got his boss to fill in for him. We're confident you're going to be a pretty able substitute. Thank you so much for doing this. So Dane County was doing pretty well in terms of confirmed cases, but is now also starting to see an uptick. What has that meant so far for UW Health? Are you seeing more hospitalizations? Do you think that you may have to close down certain procedures and services again? I think Dr. Kaplan, you're still muted.
I'm unmuted now. So Tim, thanks for inviting us, and I agree with all the comments, and they were quite insightful of Dr. Schuller and Raymond. So we are experiencing a growth in cases. As Dr. Raymond indicated, they tend to be in the younger demographics, so we're seeing them in probably the 20 to 30 age group growing the most, a little bit in 30 to 40 and some of the younger demographics. And so we have not yet seen a huge growth in hospital cases. I think at last count, we were under 30 hospital cases amongst our 3 hospitals. But as Dr. Raymond indicated, we don't know what's to come. And so we have, over the course of the last few months, expanded our capacity for ICUs, negative flow air rooms, expanded our supplies of PPE. So we have a lot of capacity now. I don't see us closing our doors like we did in March, April, and May. However, there's so many unknowns, and every predictive model we have seen has not yet to come true. So we're prepared, but we don't know what's to come, so it's hard to make commitments, but I don't see us closing our doors.
There's been increasing talk about the second crisis of COVID-19, the misdiagnosis and the delayed procedures due to the result of this halting of surgeries and other so-called elective services. Can you talk more about the impact of that? How serious is that? And are you seeing any impact yet of this delayed care with your patients?
Yeah, so I will tell you that the emergency department is not quite up to full volume. They're close now, but what they're reporting is the patients are sicker than the pre-COVID, that people have delayed care. So we're getting anecdotal reports of people who delayed care and have suffered from that. Predictively, the National Cancer Institute believes that we'll have upwards of 10,000 more deaths in the next decade from colorectal cancer and breast cancer because of delayed screening. So I do think that we're seeing a lot of effects of delayed care and canceling procedures, but it's really difficult to measure.
What, from a financial standpoint, has been the impact on this for UW Health? How long do you anticipate it will take to dig out from some of the revenue that was lost from these beginning months?
Yeah, so from a national perspective, hospitals are estimated to have lost about $200 billion in revenues, and is predicted by the end of this calendar year to be behind by about $300 million. For UW Health, $300 billion. For UW Health, we've been losing approximately $100 million of revenue per month during the apex of the pandemic in our county. Now we're recovering now, but we started, let's say, in February. We were maybe $100 million to the positive for our fiscal year, which is July 1st to June 30th. By March, we were down to 50 million. By April, we were in the red. And through a lot of cost-cutting measures and bringing procedures back online, I never thought I would say this, but we'll be happy if we ended the year with less than a negative 2% margin. And so we've completely reversed course and lost ground in just a matter of a few months. Now, if you play that forward, what does that mean for us? What does it mean for the healthcare industry? That's less capital that we have to repair our facilities, replace old technologies, build new facilities or state-of-the-art facilities for the future, invest in new programs. And it's estimated that the industry will take approximately 2 to 3 years to recover. And I would say that's what we're estimating.
So we've talked to health system leaders across the state who are at varying points in terms of getting back to their full pre-pandemic levels. Some are getting close to there, others certainly are not. Where kind of generally is UW? Are you close to some of these pre-pandemic levels yet?
Yeah, so I'm finding that a lot of this coming back is very geographical. We're all different depending on our demographics. UW Health, so our inpatients are near pre-COVID levels, so inpatient numbers. Our inpatient surgical numbers are near pre-COVID levels, but our ambulatory surgeries, our clinic visits are far behind still.
What are some of the ways that UW is now more ready for responding to COVID-19 than it was in March? What are some of the most significant early lessons that you've learned so far?
So true of, I believe, all of us is when the pandemic started and we opened our incident command centers, we didn't know what we were dealing with. We didn't know how it was spread. We didn't know how to keep our staff safe. And so what's different between then and now is we know a lot more about COVID-19. We have policies and procedures to keep our staff, our providers and staff safe, to keep our patients safe and visitors. We have better supply chain right now for PPE. We have new innovations and treatments like remdesivir or convalescent serum. And we have a trained public that is accepting to wear masks, to only have one visitor, to keep social distancing. So we've changed the facilities and how we operate quite a bit, including separating patients that are suspect of infection and not with drive-through testing facilities. So we've completely retooled our organizations to handle the pandemic. And this is, I believe, one of the reasons I don't see us closing our doors like we did in March and April. I see us ebbing and flowing to the demands of meeting the pandemic. The one thing that I think still exists as a danger, so I think we can keep our staff safe in the hospital itself with adequate PPE policies, procedures. I think a current threat that we can't get past is as the community spread widens, so does the infectivity rate of our staff, our providers and staff. They can get it through their kids, through the communities. And so we always have that threat of losing providers and staff to be able to provide care. But so far, that's been in control.
Great. And so now, Paul, I haven't forgotten about you. I want to shift to the insurance side of things. Thanks to Dr. Kaplan. We'll come back to you with some follow-up questions. But Paul, what are some of the biggest changes that you have made at Anthem in recent months that could be here to stay? For example, do you think insurers are going to be more willing to pay for telehealth going forward, or pay more than they already are for telehealth going forward?
Yeah, absolutely. Yeah. Thanks, Tim, for having us today. And thanks to the other guests for all the work you're doing. I think just to echo the last point that Dr. Kaplan made relative to the frontline caregivers, those are the people that are, carrying the burden day to day. And just on behalf of Anthem, I want to thank them for all the work they're doing. They're caring for the people in the community, whether it's the community that, Dr. Schuller mentioned or others throughout the state. So thank you all for that. Telehealth, Tim, is an interesting dynamic. We've offered telehealth services for quite some time with, varying degrees of popularity depending on, the consumer themselves, particular employer groups, how engaged they were relative to those services. Dr. Schuller mentioned earlier the the use of telehealth and the services they're providing can offer a safe, effective, really cost-saving tool under the right circumstances. It's not right for all types of care, obviously, but it can supplement in an effective way. In particular, in the times of COVID, with either a consumer is not comfortable coming into an office, but they should be seen. This concept of delayed care can result in more challenges down the road. So there's certain applications that are clearly advantageous for society. Just today, I think AHIP released the study of all across America of all telehealth services. They're up over 4,000% year over year, year to date. So significant numbers there. And 1/3 of those services are tied to some form of behavioral health visit in one form or another. So to echo Dr. Schuller's comments earlier, that's vitally important, in particular, in the times of quarantine and the social distancing. People can react, differently under those types of circumstances. And people have different socioeconomic needs and need to react differently, as was previously mentioned. So we see telehealth as a powerful tool that can be used in the right circumstance. We don't anticipate that the levels of current telehealth utilization will stay where they're at, but they certainly will not regress back to where they were pre-COVID. And so, we'll continue to invest heavily in telehealth, continue to work with, policymakers as well as our providers to create funding mechanisms to support our members. And frankly, it's one of the things that our customers have asked most about over the past 60 to 90 days. How can they leverage and how can they utilize telehealth differently? And so that's part of what we see as a trend, not only today, but in the future for sure.
How has, I've asked this question to other panelists, so we'll ask you, how has the pandemic impacted Anthem from a financial standpoint? Have you seen the drop in claims early on that some other insurance companies did? And if so, what has that meant?
Yeah, I think just more generally speaking, Anthem reacted, I think, very well early on. I think from this perspective, as mentioned earlier, of in times of challenge and turmoil, leadership needs to come to the forefront in times of uncertainty. I think Anthem as a company locally, but more importantly nationally, it's got a very strong culture around our mission of improving the communities we're in and those that we serve. So we kind of use that as our guiding light as we started to make decisions. Obviously, a very fluid situation, as we all know, and it continues to be very fluid. So sometimes making decisions in a leadership capacity can be challenging because data and information changes, real time. So we've used just that general concept of how can we serve our communities as our guiding light to make policy changes. So we've done things like, waive cost shares for treatment and testing of COVID. Those have been extended through, the remaining year. So that provides some support for our members and our customers. We have provided some significant premium credits back to our customers as well. So during, this time, and hopefully it's a short-lived for companies to come back up online, ultimately as quarantines are lifted and so forth, it gives them an opportunity to gain some financial support there. As far as the claims themselves and some of the patterns were mentioned, depending on, it varies geographically pretty significantly, depending on what part of the state. We do see, inpatient utilization back to pre-COVID levels in certain areas at certain facilities. And in other areas, it is suppressed. And there's twofold. I think, Dr. Raymond has been, like, as you mentioned earlier, like the Dr. Fauci. So he's been a calming voice across everything, using data to guide decisions on what we should be doing. I think Wisconsin's been a leader when it comes to that. And I think the health systems are very well prepared to handle procedures that need to be done, whether it's in an ASC or an inpatient setting or whatever it may be. We've done a really nice job there. There is still there's a consumer fear that exists, and certain patients are reluctant to go back into a doctor's office or into a hospital. May not be based on facts for them as a specific individual, but that's how they feel. So we've got to continue to use, outreach, use telehealth if necessary to make them more comfortable, to get them in and get the right care at the right place, because we do have concern relative to short-term suppression and care delivery and what that may lead to down the road. Dr. Kaplan mentioned some of that related to cancer statistics. So I think generally speaking, Wisconsin's done a really nice job, but there's still more work to be done. And again, the situation is very fluid. So each day we monitor for what the future may hold. And unfortunately, we are seeing the spike in particular in the younger folks in the community. That does raise additional concern for where we look for the remainder of 2020 and really into 2021.
So meanwhile, also a lot of people have lost their job throughout all this in recent months, and as a result, have many of them lost their employer-based insurance. What impact has that had on insurers like Anthem? Do you think that it is maybe increasing the consideration of joining the ACA market?
Yeah, no, I think it's a really great question. Wisconsin was very interesting. We watched that very closely to try to understand what the impact would be to the members we serve. And interesting, we didn't see the drop off earlier on. We did see a little bit going into July here. And I think many was due to federal support that was provided to in particular to smaller employers. That helped tremendously. I think employers in Wisconsin were I think very diligent. Dr. Schuller mentioned earlier, what keeps you up at night? It's making sure that people, are employed, have the ability to earn income and get access to high quality healthcare. So I think a lot of employers did a really nice job of trying to weather the storm as much as possible. What we're seeing is less of a negative impact in the traditional commercial block of business. There's obviously seen growth on the Medicaid side. I think one of the unique aspects of Anthem is because we service, traditional commercial members, whether they're an individual member or a member of a large employer. We serve Medicaid across the entire state, and we also service Medicare population. So we service the full spectrum. So I think it gives us a little bit of a unique view there. We're at heads. Tim, it's going to be very fluid. We hope that regardless of where that member may fall, that we have an opportunity to help support them in some form or another to get access to the care they need.
So COVID-19, as we've asked the other panelists as well, COVID-19 has further exposed the significant healthcare disparities that exist in our state. What more can health plans like Anthem do to respond to this crisis?
Yeah, that's really interesting, Tim. I can't emphasize that enough. Your last discussion was focused in on that. I think one thing that is very clear is that the pandemic has shed a very bright light on healthcare inequity within the country and within our state. It's something we clearly need to do more of. I'm proud that Anthem has really stepped up in a large way. We've committed over $50 million to invest in solving the issue of healthcare inequity. So there's a lot of work that still needs to get done. But it has shed a light in that regard. And I think that's a good thing, frankly. I think it's something that was well overdue. And, we're going to continue to keep it on the forefront of everything we do. I can share with you on a weekly basis, Gail Boudreau, who's our CEO, has a call with the leadership team. And as a standing item of that agenda is always to discuss this particular topic and how we can do more and do better to address the inequities there. I will say one other thing that's really quite interesting and maybe a lesson learned of COVID is that it's really emphasized that as a community, our health as an individual or as a society, it either rises or falls as one together. And I see Dr. Raymond's stay home, stay safe message behind him. And it makes it reminds us that we're all in this together. And, for the challenges that the pandemic has created, I continue to remain optimistic that we'll come out of this a much stronger society and a much better industry. And, there's a lot to come, but we remain very optimistic.
So Paul, I'm gonna stick with you, but I'm gonna shift to an audience question. Thanks to everyone who submitted questions with the registration. Unfortunately, we're not gonna have time to get through all of them, but I picked a handful that I think best represent the sentiment of the questions that were asked, and I'm gonna sprinkle them in through the questions that we asked. But Anthem is ahead of the curve on pay for value arrangements. What impact will the pandemic, do you think, have on these arrangements? Do you foresee this causing more to happen or less?
Yeah, that's a really, really great question, Tim. It's fascinating. And the pay for value and programs that we have are heavily invested around primary care. That's just a strong belief we have. We're going to continue to invest in primary care. And quite frankly, I think the pandemic itself, again, sheds a light on the need to have, to have routine preventative screenings and keep people healthy before they get sick or are subject to an underlying health condition. Because as the pandemic has proven out, people that have underlying health conditions or challenges relative to socioeconomic inequities are more negatively impacted. So if we can have a positive influence on their general health earlier on through investment in primary care and prevention, when a pandemic or the next one comes around, the individual or as a society will be much better suited to weather that storm. So I think this will accelerate the work in that space rather than detract from it.
Great. I'm going to shift back to, thank you, Paul. I'm going to shift back to Dr. Raymond. And you kind of addressed this a little bit already, but I just wanted to follow up on it. As we go forward with a virus that doesn't appear to be going anywhere anytime soon, and with no vaccine or effective treatment on the horizon, on the immediate horizon, what challenges remain? For example, you've talked in the past a lot about the supply of personal protective equipment. Where is that now? Is there enough for a surge? How much of an issue is that as we go forward, and what other significant challenges remain in responding to this pandemic?
Yeah, thanks, Tim. In terms of personal protective equipment, I think we learned that just-in-time supply chain that relies on international sources in time of pandemic may not be the best model. And I'm really pleased that I think Wisconsin's manufacturing capacity has really flipped to try to address that need pretty quickly. It was a good pivot. And I think the US probably is going to rely more on a local supply chain than in the past. So that's important. In terms of the community, though, what I would say is you don't need an N95 respirator to protect yourself. A simple multi-layer cloth face covering that you could make out of a folded t-shirt provides protection to you and those around you. And we really need to work hard on getting people to be as compliant as possible with that very simple and, in my opinion, very, very easy intervention to try to protect all of us until we do have a vaccine.
So the next question is an audience question. As the number of cases tick back up, what more can we do as a state? Dane County is now ordering masks in indoor places. Milwaukee passed an ordinance yesterday. Is that something that should be statewide?
Well, that's a policy issue, but I'll just start by saying anything that we do to combat the pandemic, consistency across the geography and the municipalities is a good thing. So we should really have a national plan that's well coordinated and where the timing is precise amongst all the municipalities and states. We don't have that. So that is a problem for us. What I can say is, what can we do, whether it's mandatory or voluntary? It's really simple. And there's not much more that we can do. And I'll talk about the 3 W's. Wear a mask, wash your hands, and watch your distance. And that really relies on personal discipline to be able for all of us to benefit.
California's governor announced yesterday that he was again closing bars and indoor dining at restaurants, and the state's 2 largest school districts canceled in-person instruction for the fall. The cases continue to grow in Wisconsin. Do you think that is potentially a step that could happen again here in the state?
Well, we may be in the same situation that California is in now, maybe 4 or 5 weeks down the road. I'm not sure what the legal and political climate would be for a statewide closure. I know some municipalities would do that. why don't we work hard to not have that happen here? Let's learn the lessons about what Texas, Florida, Arizona, and California didn't do right over the last 5 weeks as they reopen their economy and not allow that to happen here.
Great. Dr. Kaplan, I'm going to switch back to you. Thank you so much, Dr. Raymond. Dr. Kaplan, what challenges do you think remain? The state has ramped up its testing capacity to now nearly 20,000 a day. Is that enough? And what role do you expect that health systems will play in testing going forward? And what resources would health systems need to shoulder that burden if they continue to take on more of these testing responsibilities?
Yeah, so there's been a lot of attention to testing capabilities and testing more people and contact tracing. The truth is the best measure is the prevention, the 3 Ws that Dr. Raymond mentioned, so that we don't have to do so much contact tracing, don't have to do so much testing. The health systems, I think everybody has ramped up capacity to do testing. However, a lot of us are still hampered by the ability to get adequate reagents to run the test. There is the logistics of getting the samples, and as long as we're doing nasal pharyngeal swabs, it's difficult to get the sample. You need trained people to do it, and sometimes we just run short of the swabs themselves. So there's a lot of supply chain issues with testing. We don't have enough people to do the contact tracing, and as we grow in the number of cases, that even becomes even more difficult and not feasible. So we're all trying to ramp up capacity for testing, but that's not going to be the thing that's going to solve the problem. We need vaccines, we need the 3 Ws, we need people to be smart, we need to slow the spread. Testing will only give us an indication of how bad the problem is. Maybe it'll help us contain some elements of the disease, but it's not going to help us solve the problem.
COVID-19 has further exposed the significant healthcare disparities that exist in the state. What do you think? We've asked all the other panelists, what more do you think health systems can specifically do to respond to this crisis?
So all of us went through a period of time of dealing with the pandemic, then dealing with the financial calamity that ensued shortly thereafter, and now a heightened awareness of racism and the need to be active anti-racist within our organizations. And so going forward, we're going to be dealing with all 3 things. None of them are going away. And I believe that all of us are looking at ways to address the racism question within the walls of our organization, within our communities, and systemically with advocacy and policy. And I think that all of us are going to be needing to be anchor institutions within our communities, and all of us are going to be increasing our investment in people, time, and thoughtfulness on dealing with these things and addressing health disparities, which have been brought to the forefront both by the pandemic, but also by the recent events that we're all dealing with.
To follow up on the question we asked Paul, the audience question we asked Paul, what impact do you think that the pandemic will have on pay-for-value arrangements? Dr. Kaplan.
Sorry. So one of the things that unique to UW Health as an academic health system, we do have a health plan, the Quartz Health Plan. And so we've learned a lot through the pandemic. One of the things we learned, of course, is the value of telehealth. We went from 2,800 claims for telehealth in 2019 to 28,000 in April alone. We also learned that many things that we didn't realize before. So we thought telehealth was only for the young and for minor illness. What we're finding is that it's readily accepted by those that are more elder and those with chronic disease, and quite applicable. So we're still learning the bounds. But I think there's all sorts of things that the pandemic has pushed forward that will help us deliver greater value. Telehealth is just one of those things. So I do believe that there'll be a greater drive towards value-based care, but I think that will look different depending on how your organization is structured and who you are as an organization.
Great, thank you, Dr. Kaplan. Dr. Schuller, I'm gonna switch to you. As we move forward in responding to this pandemic that is not going away, what do you think are the biggest challenges that we face going forward?
Well, I want to circle back to the contact tracing that Dr. Kaplan mentioned. We think that activity has been really under-resourced in the inner city of Milwaukee. We need to make sure that we get strong and in-depth contact tracing to the populations that are hardest hit. I think it's labor intensive, it's difficult to sustain, and it's also been very much under-resourced, but yet it's a critical component to the prevention end of flowing transmission. So I would like to see us spend more resources on contact tracing, which I think will help us do better with prevention. For us in the community level, PPE supply is still a very big problem. The supply chain is there, but it's very fragile. We're using PPE in ways that you would never have thought we would be, like disinfecting masks and things that at one point would have seemed unreal. So I think the PPE supply is really also a very big deal for us.
Great. So in the time that we have left, I want to end on maybe a more hopeful note. So I have a final concluding question that we're hoping each panelist could answer. This is really going to test our muting, the muting functions of the Zoom webinar. We're going to go in reverse order for this one. So we're going to start with Paul. But what are you, Paul, what are you most optimistic about right now?
Yeah, I think I'm most optimistic on the fact that, the pandemic, despite, the challenges, it has really shed a light on the health inequities that have existed for far too long. And we remain, we're going to be committed today and in the future to solve that issue. And so I'm optimistic that a long challenge that this country has faced is finally getting the attention that it deserves. And we need, as leaders, to be fully committed to continue to focus in on that. And I'm optimistic we could solve this problem.
Great. Dr. Schuller, what are you most optimistic about right now?
Well, I am optimistic that people are resilient. People have gone through a lot in the past few months. People have done a lot of things, such as hand sewing masks and adjusting their lifestyles in ways unheard of before. So people are resilient. I'm optimistic that people can adapt to what needs to be adapted to.
Great. Dr. Kaplan, what are you most optimistic about right now?
So I've been a senior executive for 25 years in healthcare, and I've seen the threat of one disruptor after another, starting with HMOs in the 90s, low-cost imaging center, physician-owned hospitals, retail clinics, and healthcare has never really changed, despite hundreds of millions of dollars of investments and innovators. And yet a single strand of RNA, I believe, is going to change healthcare forever. And I believe what we learned through this epidemic, plus having a sustained financial platform for change, I believe that we're actually going to start disrupting our own industry and really doing those really good things that we've always should have been doing. And it's going to come from within, and I'm very excited about that.
Great. Dr. Raymond, last but not least.
Yeah, thanks, Tim. Those were all great answers. Mine will be a little simpler. I'm going to say that if it's possible to have a vaccine that's effective against COVID-19, which is a big if, I think we'll do it. It's been extraordinary to see that the normal vaccine development timeframe of 12 years has been compressed into something that may even be short of 12 months. And I would, we can criticize a lot about what we have or haven't done federally, but Operation Warp Speed that's investing in 8 candidate vaccines and the capacity to manufacture those vaccines before they've been even validated is really brilliant. And I think it's the right thing to do.
Excellent. Well, thank you guys so much. It's been a great discussion. We really appreciate all of you taking some of your valuable time today to do this. Thanks to everyone for tuning in, and thanks to our generous sponsors for making this important discussion possible.
Thanks, Tim.
Thank you.